Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten, and I'm joined by Dr. Kurt Kapels today. Doctor, how are you doing?
I'm doing well, Grant. How are you?
Good. And you are a hospitalist, so I guess
hospitalist.
the question we're going to start with, and the one I'm sure a lot of people are curious about, is what do you do?
Sure. So, yeah, it's kind of everyone's biggest question is, what is a hospitalist? So a hospitalist, I take care of adult patients when they stay in the hospital. So me and my partners are not clinic-based, we're hospital-based. So if you're above the age of 18 and your doctor uses our hospitalist program here at the hospital, we'll be taking care of you if you stay in the hospital. And so that can lead to a wide array of things, consultations for some of our doctors and our subspecialists here, direct admissions from clinics, admissions from the emergency room, consultations for anyone who might have questions on things. So we're here to kind of be assist in a lot of areas for patients who are staying in the hospital.
And I've talked to family physicians and doctors like that who have to have a wide range of knowledge. Is that similar for you and other hospitalists?
Yeah, and that's actually where hospitalists kind of develop from. The program itself is, medicine gets more and more complex the more that we learn about things, and so it was getting more and more difficult to do both inpatient and outpatient care for people and to stay on top of all the evidence and information. So hospitals kind of developed, let's be focused completely on taking care of someone when they're in the hospital and stay up to date on things we need to, and it's led to good outcomes for patients. So.
Well, and I want to talk about your journey a little bit too, because you're actually from here. So I guess what was kind of the school journey that you took, starting at Lakeview and then ending up here at the hospital?
Yeah, so I grew up on a farm about 20 miles from here. Went to Lakeview, graduated in '03. From there I went to Nebraska Wesleyan in Lincoln. And then I did all of my training, both medical school and internal medicine residency at the Med Center in Omaha. So I've been lucky enough to stay here in Nebraska, which was hopefully the plan from the start, and to be able to come back home and to take care of family and friends, which also was the plan from the start. So very blessed.
Well, yeah, and even more blessed, you have some family that are working in the medical field as well, and in Columbus. So what's that been like, just having family so ingrained in the medical community here?
It's been good. So my younger sister is an emergency room nurse here at Columbus, so I work with her quite a bit. And my older sister is a physician assistant at the pediatrics clinic here in town. So yeah, it's kind of interesting that we all wanted to come back, all wanted to do medicine, and all got to do the things that we wanted to do here. So pretty lucky.
So your sisters are both in the medical field, and so is your mom was. Did that have an impact on you deciding to come here? Obviously, raising her kids and then coming back all to be in the medical field.
Yeah, it's interesting because most of my family does farming or something related to agriculture. My mom was a nurse, and that was probably our earliest exposure to healthcare. Is we'd go with her to the nursing home or various other things, and you just grew to like that kind of environment and like the people that you were meeting. And I always thought it was fun, and yeah, that was kind of my first experience as far as getting me involved with medicine, and so I would say that was a big factor in me coming into medicine. And
being from I guess a smaller type, close-knit type community like Columbus and like the Lakeview community is, did that to play a factor in you wanting to be a hospitalist and being able to really be personal with patients?
Yeah, as I was doing my training, I could see that there was a need here in town as far as becoming more and more complex with the things that we were doing here, and I know that they were getting the hospitalist program up and going, and I knew right from the start that would be something I'd be very interested in helping doing, because you have your family, you have your friends, you have people who here in town, you're even that much more invested into wanting to do your best for people, and so that was a goal of mine all along.
This being a relatively new field in the medical community, do you see this being something that's going to just only continue to grow?
For sure, yeah. It's pretty much the standard of care anymore. It's becoming more and more common for hospitals of various sizes to have hospitalists, and it's appealing to I think both inpatient and outpatient practitioners to have hospitalists to do a wide array of things while we're taking care of patients here in the hospital, and it only helps us to expand what we're able to do here even more.
Growing up here and being involved in medicine like you have been, what's the change that you've seen? Obviously, it seems like it's been drastic, but in the medical community here in Columbus.
Yeah, so we've come a long ways, and I can remember when we built this hospital, we've added a lot to it already, especially a lot of services, meaning we're bringing in more and more subspecialists to do more and more types of procedures and have other testing done here in Columbus, which is good, so folks in our area can stay and receive the care that they need here more times than not. And we're constantly looking for things that we can do to improve upon that, and I think having our hospitalist program here is a big benefit towards that.
Well, and I want to get back to being a hospitalist and coming here to Columbus. Why did you decide to get into that field? Did something along your schooling trigger, like, hey, I think this is the right path for me?
Yeah, and it basically came out of the more that I was doing training and residency especially, the more that I really grew to like inpatient medicine. I just loved it. It was the type of environment I was looking for. I still, coming from a small town, wanted to kind of be in a small town. And this was the size of program that I was really looking for, and it's been nothing but wonderful.
The inpatient programs and really all the programs at the Columbus Community Hospital continue to grow. Has that caused your field and your work to grow, your work base to grow?
Yeah. We're getting busier by the day, it seems like, which is good. We're seeing all different kinds of patients. We're getting involved in more and more care surrounding procedures and various other things, and it's good to see that we're able to do more and more of these types of things in Columbus, and so people can stay here and receive their care here, which is a good thing.
So are there always hospitalists on staff and in the building?
So we take 24-hour call. Me and my partners are based here in town. We always have someone either in the building or very nearby on call 24/7. So yeah, we try to make it as clear as possible to our patients. We're available for you. Have the nurses call us, have whoever get a hold of us. We'll be around. If you need us, let us know.
So as far as your involvement in the care process and the transition of care process, where are you involved and what happens to the primary care?
Yeah. So obviously we don't take care of patients when they're in the clinic. We take care of them when they're in the hospital. So it's important to have a smooth transition of care both into the hospital and out of the hospital. So we keep in daily touch with our primary care doctors. If we take care of their patients here, if there's big status changes, we have questions for them, we have records for them or to receive from them. We're constantly in communication with each other, and it's only getting better as we go. So for instance, when someone leaves the hospital, we call their doctor and give them a summary of what's going on, give them some copies of what happened while they're here and what we're thinking as far as a plan going forward, so that transition of care can be smooth and people can have the best outcomes.
Well, Dr. Kapels, thank you so much.
Thank you. Appreciate the time.
For Dr. Kapels, I'm Grant Otten. Thank you for tuning in to another edition of Meet the Doc, sponsored by the Columbus Community Hospital. We'll see you next time.